Introducing the F3 fragment plating system from Hand Innovations. Used for the fixation of fractures on non-load-bearing small bones, the F3 fragment plating system is a unique line of plates that allow for in situ contouring in the axial, coronal, and sagittal planes. There are two families of plates, including the high flex plates that allow for contouring in 3 dimensions and the high strength plates that provide increased plate stiffness over the high flex design. After making the incision and dissecting the surgical site, debride the fracture as needed. Hold the plate firmly and drill through one of the end holes using the 2 mm drill bit. Measure the depth using the fast bone depth gauge. Remove the fast guide with the peg driver and discard. Install the appropriate length locking or non-locking screw to secure the plate to the bone. Reduce the fracture. Once the plate is initially fastened to the bone, the plate may be contoured using the benders. Note that the plate may be bent initially to allow insertion into the concavity. Place the cylindrical end of the benders over the fast guides, ensuring the handles are pointed in opposite directions and are parallel with the plate. Pull the handles inward. Drill the hole, remove the fast guide, and insert the appropriate length screw. For the high-strength plates, it is recommended to leave one node free between bender locations for better flexibility. Note, only the high-flex plates allow for sagittal or planar bends. For axial and coronal bends, insert the pin ends of the benders into the fast guides. Apply force to the benders in opposite directions. Take care not to overextend the plate. Drill the hole, remove the fast guide, and insert the appropriate length screw. When bending the bridge attached to the end node, the end bender must be placed over the fast guide in the end node. In certain circumstances, the plates may need to be shortened by one or more nodes. In the case of the high-strength plates, use a pair of cutters to shorten the plate. The plate should be shortened prior to implantation. For the high-flex plates, a pair of cutters may be used. However, simply use the benders to bend the node back and forth until it breaks. The cut edges should be smoothed to avoid soft tissue irritation. Use fluoroscopy to confirm reduction and placement. Close the wound and apply a post-op dressing. Hand Innovations, dedicated to excellence in upper extremity fracture fixation, is raising expectations with the F3 fragment plating system.